Klinefelter syndrome more than just chromosomes. This often overlooked condition affects males, impacting their physical development and overall well-being. Join us as we delve into the intricacies of Klinefelter syndrome, exploring its causes, symptoms, diagnosis, and management, shedding light on a condition that deserves greater awareness. At its core, Klinefelter syndrome is a genetic condition. Typically, males have one X and one Y chromosome, an XY pairing. Individuals with Klinefelter syndrome, however, are born with an extra X chromosome, resulting in an XY configuration. While other variations like XY or even XY can occur, X is the most common. This chromosomal anomaly arises randomly during the formation of the egg or sperm cell, making it generally not inherited. The extra X chromosome wreaks havoc on hormonal balance. The presence of an extra X chromosome disrupts the production of testosterone, the primary male sex hormone. Lower testosterone levels interfere with the normal development of male characteristics. It affects testicular development, leading to smaller than normal tests. This impaired testicular function also results in reduced sperm production, often leading to infertility. The hormonal imbalance further impacts muscle mass, bone density, and fat distribution, contributing to the characteristic physical features of the syndrome. Klinefelter syndrome affects an estimated 1 in 500 to 1 in 1,000 newborn males, making it a relatively common chromosomal disorder. However, a significant portion of individuals with Klinefelter syndrome remain undiagnosed throughout their lives. This is often because the symptoms can be subtle or may not become apparent until puberty or even adulthood, hindering early detection and intervention. The signs and symptoms of Klinefelter syndrome can vary greatly from person to person. Some individuals may experience only mild symptoms, while others face more pronounced challenges. Common signs include smaller than normal tests, reduced body hair, enlarged breasts, gynecomastia, and a taller stature with longer legs and arms. As they reach puberty, they may experience delayed or incomplete development of secondary sexual characteristics, such as a deepening voice or facial hair growth. Some may have learning disabilities or speech delays, while in adulthood, infertility becomes a major concern. Decreased libido, erectile dysfunction, and osteoporosis are other potential issues. Diagnosing Klinefelter syndrome typically involves a combination of physical examination, hormone testing, and chromosomal analysis. During a physical exam, doctors might notice physical characteristics suggestive of the syndrome. Hormone tests can reveal low testosterone levels and elevated levels of follicle-stimulating hormone FSH and luteinizing hormone LH, both of which are involved in sexual development. The definitive diagnosis, however, is established through a karyotype, a blood test that analyzes the chromosomes and confirms the presence of an extra X chromosome. Klinefelter syndrome doesn't have subtypes in the traditional sense. However, the severity and manifestation of symptoms can vary greatly among individuals. Some men may have mild features and few health problems, while others may experience more significant challenges. The specific combination of symptoms and their intensity depends on factors like the degree of hormonal imbalance and individual genetic variations. While there is no cure for Klinefelter syndrome, various treatments and management strategies can effectively address many of the associated challenges. Testosterone replacement therapy is a cornerstone of treatment, helping to increase testosterone levels, promote muscle growth, deepen the voice, improve libido, and enhance bone density. Fertility treatments like assisted reproductive technologies and ART, such as sperm retrieval and in vitro fertilizations (IVF), may offer a chance for biological fatherhood. Addressing enlarged breasts, gynecomastia, can be achieved through surgery. Speech therapy, occupational therapy, and educational support can help manage learning disabilities and developmental delays. Regular medical check-ups are essential to monitor overall health and address any potential complications. Since Klinefelter syndrome is caused by a random chromosomal abnormality, there is no known way to prevent it. It is not related to anything parents do or don't do before or during pregnancy. The prognosis for individuals with Klinefelter syndrome is generally good, particularly with early diagnosis and appropriate management. Testosterone replacement therapy can significantly improve many of the symptoms and reduce the risk of long-term health problems. Although infertility is often a significant challenge, assisted reproductive technologies offer hope for fatherhood. Recent research is focusing on optimizing hormone therapy protocols, exploring the genetic factors that influence symptom variability, and developing new strategies to improve fertility outcomes. With ongoing advancements in medical care, men with Klinefelter syndrome can lead fulfilling and productive lives.